Hi, my name is Carly Schiff, and I'm a speech-language pathologist specializing in voice and swallowing at Becker ENT. So to treat difficulty swallowing, it depends what the core of the issue is. So you can have difficulty swallowing that stems from the oral phase of your swallow, meaning how you put things in your mouth and chew them up and pass them to your throat. You can have difficulty in the pharyngeal phase, which is the throat area, so how the food is squeezed down into your stomach, how you protect your airways so you aren't choking on things all of the time. And then you can also have issues down lower in your esophagus, so actually the stomach part, how food is passed down into the lower part of your stomach. So depending on what the issue is, which you'll have to figure out with an exam, then we'll decide how to treat it. Typically, treatment is done by strengthening the muscles of swallowing, coordinating the timing of the food and the swallow, and making sure that you're protecting your airway really well. There's a lot of different voice disorders that can occur. What a voice disorder means in its entirety is that there's something wrong with the way you produce sound. So that could be a physiologic issue, meaning there's something growing on your vocal folds. It can even be benign, like nodules or polyps, which are just an overusage injury of the voice. It can be the way that your vocal folds function, so they may not open and close normally, they may not come together correctly when you try to make sound. You may be using your voice incorrectly, so not using enough airflow when you speak and you end up straining. And then there are neurologic voice disorders, so things that can come from having Parkinson's disease or having a stroke, and then the nerves that innervate the vocal folds are not functioning correctly anymore. The symptoms of a voice disorder is typically a change in your voice quality. So that could be hoarseness, that could be more breathiness, that could feel like the voice is raspy, it could be that you can't project anymore, and it also could just be that you feel discomfort when you voice, even if the voice sounds the same. There are a lot of different things that can cause voice disorders, and the symptoms can be similar for all of them. Voice disorders that are hyperfunctional are voice disorders that don't come from an actual injury to the vocal fold, but in terms of how you use your voice. So your vocal cords could look normal, you may have gotten a diagnosis in the past that everything is okay, and so at this point, it's just how you use your voice. So voicing is made from good airflow that gets sent up into our vocal folds. The vocal folds get set into vibration like a string guitar or a violin, and then the sound we make has to be filtered out with the way that we speak. And if any of those pathways aren't working correctly, you may end up sounding strained or you may get pain when you talk, and that's a hyperfunctional voice disorder. Thyroid issues typically do not cause voice problems. So if you've been diagnosed with thyroid issues or a thyroid nodule and you're having hoarseness, you definitely should get a full voice evaluation because there may be something else going on. That being said, every once in a while, a very large thyroid nodule can be pressing on the nerve that innervates the vocal folds. And in that case, you may have one of the vocal folds not moving correctly or not innervating correctly. And again, a voice evaluation would show you that. The most common voice disorder in children would most likely be nodules, which are like calluses on the vocal folds. They come from overuse or misuse of the voice. That being said, the same misuse or overuse injuries that adults can get, children can get as well, and that could stem from polyps to cysts to nodules like I mentioned. The causes of swallowing difficulty is not limited to one thing. It can be from a variety of issues, just from some general muscle weakness that happens with age and that's within normal limits, to having a stroke and then the brain signals are not sending the correct signals to your throat to start the swallow or to swallow strong enough. You can also have issues post-head and neck cancer, so if you've gone through radiation and all the musculature in your throat is calcified and is not working as smoothly as it used to, you may end up with some swallowing issues. Those are just a few of the many, many things that can cause what we call dysphagia, and so if you're experiencing swallowing issues, you definitely want to get a full workup from your doctor as well as a speech pathologist. Some of the signs and symptoms of having dysphagia or difficulty swallowing is what it means, feeling difficulty with your swallowing. So that could be feeling like you can't chew your foods up as well as you used to start the swallow. It could feel like you can't even swallow your own saliva, or you're having difficulty with more solid foods. It could feel like the food is getting stuck in your throat as you swallow. Some people describe it more in their chest or more in the base of their throat. It could be that you're choking on liquids when you drink. So if you take a sip and it feels like it's constantly going down the wrong pipe, all of those things are encompassed into what we call dysphagia. So anxiety itself does not cause swallowing problems, but the swallowing that we do has a lot to do with how our muscles of our larynx or of our throat function. And so a lot of times if people have anxiety, whether that be because you choked on something once and you're scared to eat or drink, or just general anxiety, then the muscles can tense up. And a lot of people get what we call a globus, which is just a feeling of a ball in your throat, and it makes it difficult to swallow. We call this functional dysphagia or muscle tension dysphagia, and there's great treatment for this. Some massage, some timing with your swallow can make your swallow feel back to normal. If you're over the age of 60 or 65 and you've started experiencing dysphagia symptoms but nothing else in your health has changed, most likely that's what we call presbyphagia, which is just the aging swallow or the aging larynx. And it's very common to start having some minor difficulty swallowing at this point. That being said, if you are experiencing dysphagia at any age, you should get a full workup and evaluation so we can figure out what the cause is and make sure nothing else is going on. So if you're experiencing any difficulty with your voice or trouble swallowing or really any issues with your throat, stop in and see us and we'll get you evaluated.